That's right. That's all right.
Oh, yeah.
Give it to us.
A long time I have.
All right, we're gonna go ahead and call the meeting to order. Anybody volunteer to do the prayer? Bingo. Do the prayer, who wants to do the pledge? That's what we. It's better to do the pledge.
Thank you, Father, for bringing us together today. Watch over us as we take in important information and help us to make decisions that work the way you want us to work together as a team. We love you so much. Thanks for choosing us. Amen.
Amen.
Please join me in reciting the flag of the United States of America. To the republic for which it stands, one nation, under God, indivisible, liberty and justice for all. I was gonna do the old school attention salute pledge. Sorry, you're good.
That's all.
All right,
Mr. J, it's up to you.
roll call. Mr. Billy Grove,
Here.
Miss Glenda Gay, Miss Phyllis Hale,
Present.
Mr. David Hardesty, Mr. Tony O'Banion, here. Mr. Patrick Pichon, Miss Betty Washington, Miss Vanessa DeVille, Miss Beth Eason, Mr. Troy Fontenot, here. Mr. Wayne Foster, here. Miss Suzanne Heath, Mr. Mike Hill, here. Miss Holly Howard, Miss Renee Overby Rule, here. Miss Lori Smith, Miss Ava Sullivan.
Here.
Mr. Chairman, we do have a quorum.
All right, I'm gonna take a point of privilege real quick. Some of y'all may have heard or may not have known, Ms. Gay's husband passed away about a couple of weeks ago, and then we found out Sunday when we went to the services that she also lost a daughter. in the past week or so. So if you would kind of keep her in your prayers. I like her. Speaks her mind. I like that about her. Been on the board with her for a while. She's got a good heart. She'd do anything for you. So if you find time and if that's in your privy or whatever, if you want to sue me later for asking, that's fine too. But keep her in your prayers. She's a fine lady. Now that being said, back to you.
All right, at this time, I'm going to hand it over to Ms. Kathy Saunier with HUB. I'm going to get her slide presentation going real quick.
Just in time it came out.
Right, yes.
They need to go through.
There we go.
There we go.
All right. Well, hi, everybody. So it's mid-year already. As you know, we renew May 1st. And we make a lot of decisions in early spring to get ready for that renewal. And going to take a little temperature check right now, mid-year, to see kind of where we're at versus last year this time, right? So as soon as Jay gets that going, we can go ahead and start on the first slide if y'all want to flip the page to this slide here. The bar graph is something that we put together and we've been looking at for a lot of years now for those who've been around for a while. The inpatient chart claim versus the outpatient claim, professional drug and other claims. So we'd like to take a look at where our claims are running versus the prior year. And interestingly enough, inpatient claims are down over $1 million, but then they push to the outpatient, which sometimes happens, right? But in theory, outpatient claims are a little bit less than your inpatient claims. So, just shifted dollars over to where those services were being sought. Professional claims are about even, as well as the other types of claims that you see. And drug claims, and this is continued trend, are continuing to escalate, but they have slowed over the previous trend, so that's good news. So this time last year, we were looking at $3.2 million versus the prior year. So that was a big chunk. This year, the good news is, at least at this point in time, we're less than $900,000 over what we spent the year at this time last year, right? So that's good because we were over $3 million last time we met at this time of the year for your mid-year review. Does that make sense? All right. So moving to the next slide, I want to talk about pharmacy trend first because that is the one area that, the inpatient, outpatient shifted, but then pharmacy is up. And for those of you who have been looking at this for a while, pharmacy has continued to be something we watch very closely because it's become such a big amount of your spend. Back when we looked 20 years ago, it was a small portion percentage-wise, and it was always inpatient things that we talked about. But now pharmacy and all the things that we do with pharmacy, different medications that we can treat things with, it's really escalated up to be a major spend category for you. 2022, it was $11.2 million for pharmacy at this point from May through October, which was an increase of $842,507 versus the year before that. In 2023, when we gathered, that was that $3.2 million jump last year. We were looking at $1.268 million additional dollars from the prior year, and we were at $12,519. At this point in the year, 2024, we're at $13,502 and some change, which is an increase of $982,666, but it slowed from where we were, and this was the migration year. What do I mean by that? We put in a new pharmacy benefit manager at 5/1, and we had a couple months of transition. So let's take a look at that on the next slide. I think Jay's catching up to us, I hope, because this is a really busy, full of information. So that's why I put this slide alone, this right here, this information, that's the reason I printed out individual pages for you guys this year, instead of doing usually I do the notes pages with 2 per, but this was the reason why I did it as individual pages. And then highlighted are some of the key takeaway points here. So you might remember that we
we used to contract through Blue Cross Blue Shield's pharmacy benefit manager, Express Scripts. And the change that was made at renewal was we went direct to Express Scripts through a different contract with Crumdale Partners. What that afforded us was an opportunity to tap into a national agreement that Crumdale Partners has with Express Scripts to get deeper discounts on some pharmacy, to be able to become more flexible and able to adjust to things that are going on in the marketplace more quickly. It also allowed us additional insight and transparency to data. So the data and the reporting that the team now gets is much more robust than what we had before, especially when it comes to detailing when we drill down to the rebating. They get more information. We used to not really know, well, here's the rebates, but we didn't really know how we got there, right? And so now we have 100% of the data that tracks back to that so we can monitor it. And we also have additional pharmacy management programs in place today. One of the plans that we put in place was Save on RX, and that one, granted, Blue Cross did have it, but when we contracted with Express Scripts and Crumdale, we went a little bit more robust than their standard offering. The Save On program takes specialty medications, which are all the expensive ones that you can think of, right? And it takes and it puts it through a Credo specialty pharmacy network so that we get the best bang for our buck. Okay, so you get the best pricing and the best contracted pricing. Now, part of that meant that we did, at the time, remove an opportunity for people to get their specialty pharmacy medications filled at the local level. That has since been rectified at Jay's insistence. Really, we went and but Crumdale and Express Scripts directly contracted with Lake Charles Memorial Hospital's pharmacy, and now we have a specialty pharmacy right here in town. Do you want to say a few words about that in particular?
Yeah, we had, when we switched over to using Crumdale as our PBM, we wanted to save money, as much money to the plan as possible, but we wanted to have as little impact on the members as possible. And so the smallest group that we had to take into consideration were people that were using specialty pharmacy. Of the 7,500 members that we have, only 111 are using some kind of specialty drug. And so, so they were impacted the least, but there were 34 members that were using our Lake Charles Memorial Hospital pharmacy that were automatically moved to a Credo, so they didn't want to do it. And so it removed that local, someone actually hears on physical you can talk to aspect. And we do a lot of other business with Lake Charles Memorial Hospital outside of pharmacy. They do our athletic training program, which saves us literally hundreds of thousands of dollars a year. And we work with them on our workers' comp benefits program. And so we do a lot of other business in other spaces with them. So this was just one piece of business we could get back to them without impacting the other areas. And so it didn't quite get all 34 members back to using them, but who they did get back, they were very appreciative of it. So.
Right. So it was really a win-win. And the impact of that Save On program, if you look down to the bottom two highlighted notes made there, and you'll see specialty percent of plan costs, and in May it was 51%, 54% in June, and then look at what happened in July. It dropped significantly. More importantly, on the next line, you see the specialty plan cost per member per month went from 164 down to 110. It has crept up a little bit, and you have some ebbs and flows there for when people get things filled, but still significant savings over where we were before the Save On program was implemented, right? And so that's really having some immediate impact to the bottom line. So we're excited about that. One of the goals when we moved the PBM, to your point, was marginalizing any noise and any disruption, right? We were really, really mindful of that. So we stepped into some of these programs over time when we had good information, when claims were being processed. Okay, now we're going to turn this one on. The next one we turned on was August 1st, and that was putting in some more measures in terms of management of the different prescriptions. And that all impacted on August 1st. So we also see some spend coming down then. So at this point in time, your generic fill rate is averaging right at 87%, which is good, okay, which is better than what we were at. And every 1%, really significantly notches it up again. And so we're having some good traction for that. The rebate payment for the first 2 months was $1.581 million, which equates to $110.73 per member in savings. And we use that money, we account for that money when we're calculating what the rates need to be for the next year. I mean, that's real money that we calculate back into what the rates need to be. Previously, the planned rebate per member per month was at $91.51. So again, that's a nice boost, and we're about to get another statement in January that will have additional data to report back on. The specialty medications we talked about, 45.6% of plan spend as compared to your peer group, which is at 51.5%. So again, we're seeing some good traction with those programs. And we talked about Memorial Hospital. Do we have any questions on pharmacy before we?
Yeah, I have a couple. We made a couple changes last year that saved us, the board and the employees, quite a bit of money by going up on the deductible and on the maximum out of pocket. We haven't really made any changes to the drug stuff. We're kind of talking to Jay and Rich and them and their team, kind of maybe doing some different stuff in there. Do we have any idea of what percentage of the people that are using the drug program, like me, who've gone through their out-of-pocket maximum? Is there any idea like how many are still getting drugs but haven't paid their deductibles?
Okay, so that, I think you're referring to a little bit of the loophole with couponing.
Well, what I want to do is we haven't really made any changes to the deductibles for the,
Okay.
yeah, and chemo fog is kicking me bad this week for some reason, but yeah, co-payments. I want us to look at when we come back up for the renewal to make some change, not drastic changes, but some changes where we can go up on the co-pays a little bit and also go up on the maximum, I forget what the deductible is on those, it was $500 or something like that. Yeah, could go up on that, because if you look at the charts that you're saying, I mean, our drug costs are constantly going up. Even though we made changes, I think if we, as a committee, the board can come in and make some tweaks on that, I think it would help the plan out on the long run. We are getting more, we don't really have a lot of people left on the plan that are not on Medicare eligible, so that's helping us out quite a bit. But I think if we make another small tweak or two this year coming up, I think it'll help us on our renewals. It'll help us on what the employees are paying.
And we definitely, in our renewal presentation, we did have a slide of different options with copay changes and deductible. The standard deductible drop for a drug card would go from 100 and it transitioned to 250 per member, like on that high option, right? So that would probably be the next step there, but we could explore, maybe something in between. Is 250 too big of a jump for a pharmacy deductible?
I think we could look at maybe going maybe 300. It's not big enough $50, but if you do $50 compared to 7,500 lives.
Right, so maybe from 100 to 150
I'd go to maybe 250.
to 250, okay.
Yeah, we can definitely.
We definitely have that.
have that option.
We can definitely look at that.
Yeah, I don't want to really go out anymore on the maximum out of pocket. I think that number that we did, I think we'll see the benefits of that. But I think if we made a change on that, I think we'll see quite a bit of difference on this. I mean, because one thing I was I'm glad you brought the percentage up. We were talking about the percentage of generics that we use. That we made some changes, matter of fact, with the dad, I think on that change of deductibles on that to kind of force that change. I'm glad to see that is still seal the case. But I think if we can, when we come up with the renewal, to kind of have that figured in to give us some options for us to kind of look at, I think
Okay.
that would be an easy sell. I think the benefit on the premium savings per member would be really.
Yeah, and I also have a slide about the last time when you made that deductible change, I think it was 2022. And we saw some significant change in enrollment to the higher deductible plan, so we're gonna talk about that in just a minute as well. So just kind of, lots of different things.
And also, look, one thing we kind of need to, Jay and I talked about this, there's several different ways to kind of fund it. We have, what is it, flexible spending account or health savings account or whatever that is. Not every employee that we have is on the plan, but a large percentage of them are on the plan. So I think we as a committee and the board may want to look at if we have another big year as far as for supplements coming from the taxes, and especially if everything kicks off in South Carlos and all that kind of stuff with the gas plants and all that, we're going to see revenues coming in. If we could instead of giving all of that out, take a percentage of that, do a one-time gift into the employees that are on the plan to help fund the savings account, for them to get there to kind of maybe afford to go up on the others a little bit more. That way, it's going to cost them more, but we'll put it in there, and they can take the additional savings that they're saving per month and dump that in that health savings account, and that kind of helps balance that off. That'll come on an educational thing from us as employees to be able to do that, but we've got to start doing that, because then if the way things are kind of going, we're going to have a limited time to be able to fund that with the tax revenues coming up. But it's going to eventually come to the point where I'm going to be off the board. It's going to be the future board. You're going to have to look at making some other changes in there. But if we have those things in place and it rolls over, like used to, if you didn't use it, you would lose it. Now it rolls over. So younger families could keep adding into that, and it would help them when they do have a downfall. So just kind of, it's something we need to look at as far as for this community, the board being proactive on what we're doing. And I'll shut up.
No, that's all good. And yeah, I love health savings accounts. It's something that, it's a big education piece, and it's also, if the board could find a way to kind of get people started in that savings account, that is a beautiful thing. Because like I have a group today that the premium difference and what the employer's funding, which is $50 a month, winds up covering the whole deductible for the high deductible plan. So,
That's like we get out those monster supplements this year, or, that they got. If we were to take $1,500 of that for the ones that were in the plan and dump it in there, and get it off the ground start, I think it'd go a long way to be able to do that.
Oh, it's a wonderful tool.
Yeah,
It's
so
a wonderful financial
I
tool.
think just food for thought for as we come forward. Yes, sir.
As a site-based administrator, I try my best to go back and explain to them on my insurance business. I try to make it as simple as I can. I don't know if this is my first answer here, but there is. They don't do anything in regards to really explaining that, so that falls on us to try and explain, and I make a concerted effort to do so. So I don't know what can be done to provide a clearer explanation to the employees before the decisions are made.
Well, besides your team, who does a great
We
job.
work we're a customer service department. We need y'all to enforce that out there. I mean, that is what we do all day long in health insurance, is answer calls and talk with people and explain things in detail. We will spend 20, 30 minutes, however long they need. And I'm getting out there and speaking more, but we rely on everybody else's open
Right.
tell, you know?
It's just,
Um,
there's a lot of us,
yeah.
and I don't know if everybody knows they have the option to call you and come speak at the in-service day. There's not enough.
Well, and
That's the problem.
so there are some tools we can deploy using technology as our friend. We can, create YouTube video links where you can click on it just on subject to topic by topic in the medical arena. And that's something our team at Hub can create and push out through, the normal channels.
I have that where we were working before, I didn't have their insurance plan, because a lot of people didn't understand what their savings accounts are, didn't understand the benefits and all the, how it could help them in the long run. So I had them make, with the HR department, like you were talking about, just short little videos that define what that is, how you fund it, how you can use it, the benefits of it, especially the tax benefits. And then how now that it's continuation, it kind of goes on, so it kind of helps them out. So I think if we could do that, we also, Jay and I talked about doing, like a lot of our employees are getting to the age of Medicare. What's planned? They're trying to have meetings, maybe a couple, as they turn 65 or, twice, whatever the enrollment is, to be able to do that. Because y'all get hammered on, like, conversation you and I had. I think just being proactive, but it's a staffing deal for y'all, I think.
Yeah, there's simply not enough of us. Me and Stacey do get out, we do about 3 times a year. We have one on the west side of the river, one up in here, and whatever, we let kind of those constituents drive the conversation. But that is definitely something we can get Rebecca Hannegriff with First Financial to the state. Every employee has to meet with them around renewal. That's one thing that we can push, and make sure each representative talks about HSA. Let them know.
And we can,
Troy and I don't have the same people coming out, so our office is right.
Right.
I'm gonna agree on this. My staff is not getting the information for financial, but they do, detailed, I know that. I agree, if you know it, they don't know to call you. They know that in April, they're gonna get an opportunity to address it, and they're gonna get a few minutes, and they're gonna hurry up, sit down, and say, I need to get through it. They need more time, they need more time.
well, and, I mean, it's probably truly a staffing
Talk about what
situation.
that looks like as a teacher. Great
And,
idea.
and that's what I was
Exactly what I'm
thinking.
saying. Let me tell you what it looks like when y'all come out for those 2 days that we have to make with y'all. I had a parent meeting at the door at 7 o'clock, and I was hoping to get in there and get some breaks put in. So now I'll talk to a parent from 7 to 7:30. I have to start those at 7:30, 8 o'clock, get his out of bed, and then I have to go meet with these people. Yes, there's information. I always utilize, tell you the insurance I have the whole life insurance, I've had every insurance y'all have, I'm a real big insurance person. I sit there and ask those questions, but you're trying to fit in a whole bunch of teachers at a plan time, and we're already too many things to do, so going to that meeting is stressful. Listening to that information is stressful. Even if you're telling it to me, I'm thinking, I got to get some breaks put in because today is done. That, I think we need to consider what that looks like. Great ideas, yes, we don't get all the information. I always ask my insurance person 100 million questions, and I sit with the price for the whole hour. But not every teacher does. I dread, even though I ask all these questions, when they come, because I'm like, I know I have 15 million things to do. And we say to people who call you, we can't even go to the bathroom without letting our kids up. There's just not gonna be any phone calls during the day, and we're not
Very
complaining about
respectfully,
that.
we're there till 4:30. I mean, so we're there past the hours, y'all
Yeah,
are
right.
in
But
school,
again,
you know,
There's
so-
kids,
and we work all
kids are even
summer.
going till 3:40, and then I have a parent phone call. So I'm not complaining, I'm not putting on.
No, I
just
know,
think we
but
realistic about what these conversations look like in the school.
If you could click on a video when you had time, would that be something you would do or
Maybe,
no?
but it is not that,
Right.
again, I do that probably.
We know that- I know that's reality.
Would, except that, I would tell you right now, I already got 5 emails sent to my wife, I'm probably gonna get that done, I'm already behind, I gotta put this child's SLT information came in late, I started doing my SLTs, I was doing a week ago. Yes and no, I love the idea, that's what I'm saying, it's not bad ideas, I love the idea, but you gotta look at what it actually looks like. Most teachers, most of them are like, yeah, I need to look at that. Most of us are going to say, we're going to look at it and forget, or get so busy or so overwhelmed, and when we're looking at it, we're going to do 15 other things. I think we'll set aside a time where we don't have other demands of students, of classrooms, of a parent walking in. I love that y'all come out to the school to try to explain stuff to us. That's why y'all usually come out, and usually a lot of stuff is already due. Y'all come out during SLT time. Y'all come out at times that are hard for us, more work. Not that I can think of any time that would be good. But I think what maybe there was maybe professional development days, sometimes like that, to sit down with employees where we don't have students, parents, admin, all these other people also doing.
I have, my son does that in a different parish for a living, and he always says there's about 10 different things that comes up in every single meeting. I think if y'all could get what is it,
First Financial.
them and narrow down, say the top 7 or 8 things, and then address that either with a video or an information packet or whatever, like we're talking about, the employees can go in, click on that, read it, study it before they go in. The meetings, I think that would speed a lot of that up and help y'all out. So I don't know if anybody wants to make a motion on that. I'm the chair, so I'm not gonna do that. I don't think we need, I think you understand, and I think that the benefits of that in the long run, it would more than help them. Thomas has tried to get some of the parishes up there to do that, because he deals, and we don't have time. It's like, you don't have time because you're dealing with this on hundreds of people, but if you dealt with it this way, you wouldn't have. So, but I think it would benefit us if we would do that, so that's not a proactive thing, but
I'm sorry, I wanted to ask a question, Chase. For open enrollment, if you all send out, here's our window of open enrollment, the FF enroll system, right, is that open 24/7 for employees, and they can wear?
No,
Okay.
they can't touch it.
So an open enrollment, they have to see a person.
And they can schedule 75 locations with the staff.
And you have
It's a
several
plus.
teachers trying to get in at the same time, the same hour, and we're just trying to beat each other because it's a required meeting that goes out.
And forget my ignorance, why are we requiring that they meet with each person?
That's their one time a year that they have opportunity to make those changes with.
And even if they don't want, they have to, it's not the way it's written.
We don't need to tell them.
I guess my concern originally asking, so if you took a typical employer out there during open enrollment, when they're using these these platforms, these electronic enrollment platforms, so for example, whether it be Memorial Hospital system or whatever, is a client of ours, they just say, hey, open enrollment is these 2 weeks, and the system's open and everybody can go in 24/7 and make their elections.
With no communication by anybody. And that's what
Well-
they're asking for, is to have knowledge and be more communication.
Well, there'll be meetings and there are people available, obviously, to help people if they have questions, but at least you can go on. I guess my concern, and we can talk about this and discuss this, I don't know how much of it is First Financial trying to be in front of everybody so they can sell somebody something. Sign them up for supplemental benefits or whatever, versus, hey, me being able to go and make my election, they have to look at night, I see everything there. We have video links, which we have in other clients.
We also have other things that go during that time too, they're not part of that too.
So your annuities, 403Bs and
All that.
457s and all that.
Yeah, so look, the issue is when they come in, take my staff, they come in, they're in my building for 2 days, and they see me and they see all the CPAS. So they're gonna see 75 people in 2 days. You can't do it. So if you can't do it and explain, give everybody 15 minutes, it's get through. So I think what everyone's saying is, people need an opportunity to know what they're getting into, and they need more time to be able to process that, whether or not that's through videos that we prepare, we give them on PD days, whether or not that's something that we do during the first couple of days, where we give them more information up front, so that when they walk in and sit down with First Financial, they need to know what they want. There's not gonna be time for them to go through 20 minutes, 30 minutes, because there's too many.
So I think we can talk, and certainly we can talk to First Financial, or even, I think within COG, we could probably do it. So, I don't mind saying, recon management, engineering, whatever, something, we plan around 1,000 employees. This year, we actually prepared a long video, I think it's about 2 minutes. And it went through every benefit that was going to be coming up for renewal for January 1. So they opened up their open enrollment yesterday. So at least the people have an idea of here's what's out there, here's what's going on. So they're informed when they go into the system. The difference is their system, those people tonight go in and make their elections on they're not having to see anybody. And I don't know, maybe we can't get through that hurdle.
We have many staff that have no access to a computer.
Yeah.
You know, we have many staff that don't work on a computer day to day, don't have access to a computer. So that aspect is challenging for our staff.
And that's when you have the enrollers come in, and that's addressing that need of those people who don't have a computer. That's part of the reason, you know.
And they can.
So look, I think First Financial,
Do y'all think would a link, so we send, as soon as the board votes in March, that votes our renewal process, I send the very next day typically, or the day after that, I send out the renewal email. I mean, it's usually prepared and I'm just filling in numbers after that to all the staff. That shows any change, any increase, flat, the board absorbed, whatever it is. We can add a link in there with a video that may explain. We get the information out. Some do not take the time to, yeah.
But this, you know, it's this time of year, so I can have this conversation. I think what you're hearing from everybody is we need people to be better informed about the decision making. However that happens, I think that we recognize that trying to make that decision and putting it in the hands of First Financial, people are not adequately prepared to make decisions and understand decisions. So we need to front load it. So I think if y'all have an opportunity to talk about how you can achieve that, how you can get that information out there, whether it's video, whether we go to something where people have more time to choose. And I hear you saying about not everyone having access, most people have access to the online. I promise you they have the phone, they can go through and if that opportunity is given to them, and they can make those decisions through that period and not have to do it in 15 minutes again. That might be a benefit too. But basically, I think what we're saying is we need to get more information out so that we can make that decision they have.
If we can put HSA stuff out right now,
And is there even an in-service that maybe we can focus on that component alone, you know,
there's
just talking about?
January 6th.
Is an in-service, so that's a quick turnaround, but that's,
But it's at school sites.
yes.
And we do a lot of that kind of information, I don't know with your technology, I assume the Teams meetings are something that can be easily accommodated.
If we can push 20 minutes into that January 6th.
If we can
Allow
afford,
questions to flow through Stacy and Jay's office, which can allow for a better education of the employees.
yeah, if we can afford 15 or 20 minutes for a
Yes,
video and kind of push it out as we do, like some of the August 6th.
A smaller bite as opposed to 30 minutes a day before they come to ask you.
I was curious, because, I mean, everybody I talked to knows, and I may be running with a different group, knows what HSA is all.
Yeah, they,
But our utilization, how do we stack up to HSAs with other districts, organizations about our size?
You've been
Very low.
gaining in the participation, which I have a slide of that, just a minute, everybody. This is a robust conversation, I love it.
Well, and I'm just thinking like, a lot of education is great, I agree that First Financial does not touch on that stuff.
Okay.
It should. However, will more education result in an increase in HSA? I'm not so sure. I mean, I don't think everybody wants it, right?
I've always said, this is my personal take on it, that the key is alluding back to what Mr. Rose started with. If you can find a way to fund into it, because when you fund, it's all about funding in that HSA account. And once people get that going and understand that, they're never gonna let that go. You know, it's all about that funding into the HSA. Otherwise, they're like, this plan didn't add a high deductible, and that's what you're gonna hear. So we have to really do that education about the flexibility of this financial vehicle called the health savings account.
now I will say in fairness, if you took our 400 clients that we have out there typically though, we still will have a copay option because
Yes,
while
we
I can show you that I can sit down with an individual who maybe even is very sick and takes a bunch of medicine and show them that, hey, when we get to the end of the year, you would have been better off on the high deductible from the mass perspective. It's still from a cash flow perspective, doesn't work for some people. And
Right,
some people can't front if they had to come up with more than $1,000 for a medication or whatever. So, you know, I still believe in having, personally,
yes.
I still believe in the choice, having the option, I mean,
And you empower your employees to make the choice that's right for their
Yeah.
situation.
So let's kind of rein it in real quick.
there's, I know there was one question.
Hold up.
I think it's few people can cover, but if added to an in-service when, at least the general educational part, but also and I know Jay has tried to explain like the new hires, the self-insured, how that works. And I don't know if there's a better way to do it, but I get a lot of people, like, what they hear when he's trying to explain it to them is that he's saying, don't get sick, don't go to the doctor, you know what I mean? I'm not saying that's your fault, but
That's the plan I follow.
yeah,
Think about this thing,
but
yeah.
we can add somehow an educational part of that, people don't take it like we're telling them.
What I'm hearing,
People don't
kind
sit.
of, what I'm hearing everybody say is, one, we need more information. If we're gonna push HSA, we need to get that information out into the hands of people that are gonna need it. So we'll get with Rebecca Hannengriff, who's our First Financial representative, and we'll get them to prioritize that education piece when they do sit down with our employees. We're also gonna check to see if there's a way to filter between those who have health and life insurance with First Financial and us, to see if we can prioritize them first, to get them to sit down with these representatives first, to give them more time. And then if you don't have insurance, or you're not interested in insurance, we'll push them to the back of the line and see them nice. And see if we can find a way to filter and prioritize that. And then we'll also see if we can, January 6th is gonna be a tight squeeze. It might be closer to a March in-service date. But we'll see if they can give us, create some videos where we can push out, even if it's a 10-minute video, something that we can show at every school, send out to the administrators, a link to it, and have every employee sit down and look at it.
When does the board need to make decisions?
March.
Yes, a lot, we don't, put out something in January, it's changing tomorrow. I mean, I'm not.
No, it's
Your general education.
General education.
Yeah.
How's the next, what is the next thing? Okay.
Yeah, so basic education part, they'll be more informed to ask more intelligent questions. Let me go to the lady, and I apologize for forgetting.
Okay, so, I know y'all talk about educators and the new services they have, but,
Bus drivers don't really have a one community.
services. So there have to be
So
some.
we have bus drivers, we have janitors, we have cafeteria staff, I mean,
I'm assuming this doesn't apply to retired people because they don't really have any interface with First Financial.
Correct.
For retirees, we send a, we mail out a packet, and it boldly states that if you're not making a change, there's no action needed. So if they're making a change and have questions, they call us.
And an online option for individuals.
Yeah.
Within the day for people who have more questions.
Here's the thing,
Right.
it's either an all or nothing, and that makes me very crazy nervous, I'll be honest.
Yeah, because,
Everybody touching our system that we have worked really hard to get it to where it's at.
oh, I understand, they keep trying to get it too. But at some point, I mean, because I prefer not talk to them, to be honest. I just make all the decisions.
Well, I think
We get
I
that.
think Jay's point, like Amy moved if you're waiving your coverages, you have no questions, you go the last hour of the day. I mean, that takes 2 seconds.
Things don't work like that, though, they got flags, that's all.
They don't have no-
All right, let's kind of get back on track. I think that was probably one of the best discussions we've had since, in a long time. I think I understand what we're kind of asking for, to kind of go forward, so.
All right, so, hey, large claimants, prior year over this year, we're pretty steady, but we had 4 last year, and we have 5 this year. And we've spent, some more money this year on 2 claimants that are hitting over that threshold. Reinsurance recovery is slightly below where we were last year, so fairly steady, but just want you to be aware of large claimants, because of course we have insurance in place to pick up everything over 750,000, so we really track that pretty closely. Now moving to the migration to the high deductible plans, which we kind of talked about, so great transition here. You guys, I remember back in the day for years, you had about 300 people on the high deductible health plan, that low option. And then of course we had to put a PPAC option in to make it affordable because of the Affordable Care Act. So what we're seeing now, and it really happened when, we changed from that $750 deductible to the $1,250, and we upped the out-of-pocket amount. People like, well, let me look at what else is out there and what the premium difference is. And the premium for that low option, the high deductible health plan, is half of what you're spending under the PPO option, correct, Stacy? Yeah. So it's positioning itself to attract people into it, right? And so you see migration, and now we have over 1,000 people in the low option and another 216 in the $5,000 deductible option. All of them paid the same in terms of big stuff, right? It's just how you're getting to where the plan's gonna then pay at 100%. What is that out of pocket amount? What is that deductible? And when you move to a high deductible health plan, you lose what's called a copay. You can't just go to the doctor's visit, to the doctor's office or urgent care and pay a $5 copay and walk out the door. You know, you're gonna pay more, which is gonna track towards your deductible. So you're gonna pay the Blue Cross rate, which is probably for the Green Door people about $145 to see an urgent care visit. But if you think about it, I was gonna pay $55. Now I'm paying, $145, and it's tracking towards my deductible instead of towards my out-of-pocket. So that's just kind of how they work. And people really have migrated over to this new plan now. With the migration though, the way that Blue Saver plan was always structured, the school board set the pricing to attract people into it, right? Hoping that they're gonna be better consumers. I'm gonna shop for my health care. Maybe I don't wanna go to the emergency room. Maybe I can't wait to go to my doctor's office or an urgent care setting so that they can spend the dollars more wisely. With this migration, it's especially vital to the fiscal integrity of the plan that we continue to monitor the claims on that plan and the funding of the money feeding into that plan to make sure that the actual actuarial values for the benefits are still aligned. Because we are we need to make sure the integrity of the whole plan is stable. So I'm just letting you know that we're looking at it closely, right? And with that, I did want to look at the plan participation year over year, and you can see at the bottom, it's 2022, where we had that first migration over, and you had 887 people, and the year before that, it was like 300. And now we're up to 1,025, 28% of your group is on the high deductible plan versus 72 on the PPO. So that's good. I mean, it's kind of, they're looking at plans, they're kind of shopping. So to the point made earlier, I think it'd be really an opportune time to take a few minutes and talk about the basics of how those plans work, right? So we were also asked, hey, like as we're talking about high deductible plans, and to Mr. Hill's point, he's made before, everything should be maybe a high deductible plan, right? We should lose the copays, and, that way everybody's being a good consumer, right? So we looked at some financials on that. We had our actuarial team take a dive into that. Currently, you're at a $1,250 deductible with a $4,000 out-of-pocket amount, and that was the last change that was made to that plan. If you entered into a new and changed it, let's say to a HSA plan with a $1,650 deductible, which by the way is the lowest one you can have in those types of plans, with a $3,300 out of pocket, again, you're not gonna have copays in this world, right? What would that look like in terms of financials? And to make that migration from the current $1,250 to the $1,650 with no copays would drop us almost $1.3 million in terms of needed funding, okay? On a $2,000 option with a $4,000 out-of-pocket, which is your current out-of-pocket on that high option plan, currently there with the copays, that would look more like $3.4 million. But no copay means the deductible must be met before any services are paid by the plan, other than your wellness and safe harbor drugs, like for your high blood pressure, your cholesterol, those are still gonna be paid at 100%, okay? But to the point of Mr. Gregory, some people that's gonna be uncomfortable for them, and they're gonna be like, hey, I don't have a copay, and this is not something that I can see myself affording to go to the doctor, because I don't know how much it's gonna cost, right? They know how much it's gonna cost with a copay. So that becomes, a disruptor. After the deductible is met, the co-insurance applies to the out-of-pocket maximum. But both of these scenarios kind of take into account the worst-case situation under the current high option, which is $4,000, right? But it's just a different way of delivering that. So with that disruption, that brings an opportunity to say, how do we close that gap to perhaps, okay, for the people who are able to familiarize themselves with, the big picture, and they're really thinking, I've got, 2 kids, and I'm a single parent, and blah, 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 and I've got to meet the financial obligation of taking them to the doctor, how can we maybe soften that blow? And so with that, is Billy that's forward with this over. So with that, Jay started exploring, Jay and the staff started exploring, so I'm gonna really let you kind of talk about what you did.
So we met with the police group, like Mr. Van had asked, and talked about within the feasibility of joining together in a partnership of using their current employee plan. They were against it for several reasons, but mainly because they were already at capacity. They already see 38 to 40 patients a day, and they only have 1,500 employees. With their employees and their dependents, they're at capacity, and they have no appetite to increase that capacity. They have no appetite to add to what they're already seeing. They don't want to create another clinic on the other side of the river. So not only the capacity of their staff, but also of their physical limitations, they're just not interested in doing that. So we figured in the first place, but we figured we'd ask. So we went on to the kind of the next best thing, looking to partner with someone outside of, the government space, someone in the private space. So we went with Lake Charles Urgent Care to see what they could offer us as far as what an operation would look like if we joined with them as them being our dedicated employee health clinic. So some positive things, they have multiple locations. They have 2 in Lake Charles, 1 in Sulphur, very good operations of hours. So 8 to 8 during the day, and then I think it was 9 to 5 on the weekends, something that is effect. And then the broadness of care, they could do everything up to going to ER. So they could do sutures, so needed stitches, if you needed an X-ray. Of course, they didn't have an MRI machine. They had all of that together. So that was very attractive. The limitations were the lack of a primary care physician. So if you needed to go to, for me, I live in Sulphur, and I wanted to go use Lake Charles Urgent Care as my primary care. They couldn't do that in Sulphur. They only have 1 location, that's in South Lake Charles, down by Bar. That's the only, if you want to see a primary care physician, you gotta go to that clinic. Someone that lives in Starks or Bell City is not necessarily gonna want to drive all the way to South Lake Charles for their primary care. So for that reason, it made them kind of unattractive. Especially those people that have chronic illnesses, diabetics, anything that's ongoing that needs constant monitoring, they can't do it at those satellite locations. And so for that reason, it made those 2 satellite clinics not a full clinic. And so one of the things that we're looking for in this is primary care, ongoing primary care that puts our employees in front of a qualified physician at a reduced rate. And so we're still searching for that, but Lake Charles Urgent Care would offer us a good option as an urgent care facility that would take some of those unnecessary ER visits and steer them towards there and would save us some money. And they're willing to partner with us on that. Just we'd have to put out an RFP in order to do that. And putting out an RFP is kind of where we're going to lean on Hub to help us not only for the urgent care but also for the employee health clinic. So we're still searching for a dedicated employee health clinic, but we're moving in the right direction.
Right, so one of the resources we have at Hub is a whole team of people who do this nationwide. So not their first time, they can already read through, depending on through the discovery phase, will determine certain needs that you have, and they'll be able to pull together some providers to dig deeper and to see if that might be an option for us to consider, for y'all to consider. So the goal, of course, savings to the plan, right? We're always mindful of that, and also enhancing the employee experience by providing that accessibility to care, especially if you do want to lean your model towards, a high deductible health plan with those HSA component and away from the copay format. So. Questions?
Who is the police jury? I mean, which level is
Ms. Laura Bolton.
good? I mean, I know most of the jurors, but, I would like to. For the people.
Yeah, she met with, Mr. Jim Bean, or who's the, Ryan, Jim Bean, was, sorry.
He was.
Mr. Ryan Bean, she met with him, they got him. They didn't have the appetite. Right at this time, it's just,
Yeah, well, I was saying, I mean, there is, with the jurors, there's interest. Just, that coverage for them, that's not true. I mean, everybody, they have, could handle,
well,
Yeah.
if we ran into it. I just think it'd be a lot bigger cost.
yeah, like I said, I'm open to ideas about how to get that done, but from all the conversations I've had, there's zero appetite to do it. But if you know who I can talk to or how to get that done,
And there are other national partners that do these types of clinics, where you don't have to take on the liability. That much I know, other than
Like,
that.
for urgent care, they can get it. If we direct that to people.
and that was one of the concerns, like, if they can't do primary care at all three physicians, like, at all three facilities, that's kind of where the conversation stops. Because we need primary care, wherever we go, we need primary care. We want the people to go to the same consistent doctor, and so that's kind of where the conversation stopped. Because they didn't have the capability, but there's no real reason to explore that any further. That Lake Charles Oak Care is just the first one we met with. We do intend to put out an RFP.
Yeah, so
They're just the first ones we met with. We want to put out an RFP and put out some criteria to open it up to everybody. We just wanted to get the conversation started to see, kind of find out what we don't have, So, yeah, we do want to put an RFP, and I'm sure in Imperial, St. Pat's Auctioneers, Memorial, everybody's going to put in for it, I promise you. They're just the first ones we met with, just kind of put a feeler out to get the conversation started.
the baby steps. All right, so being mindful of our time, closing remarks, the wellness program, again, you guys implemented a little bit new offering. You want to talk about it real quick?
So, Ms. Mary Clovis at Sulphur High School was a healthcare lead at Sulphur High, and they were already doing kind of their own wellness challenge. And so me and Ms. Tanya Sunday partnered up with her and sat down and met with her, and kind of piloted a program that I think will bolster our existing wellness program. Right now, it's about 15% of our population participates in the wellness program in some capacity. We have 6% that complete the program, and we wanted to get that up. Rather than just a one-time-a-year thing at the health fair, we wanted to get something more granular, more ongoing, more year-long. And so we're piloting a program with Sulphur High and Ms. Tony McCardle and CTE program that does it at the site. They do the program at the site or at the school level or department level. So at Sulphur, they have 50% participants out of 50 participants out of the 208 total people in those two schools are doing a steps challenge in the fall. And then, so every week they turn in their however many number of steps they take to the health lead. And then in the spring, they're going to do 4 pickleball tournaments at each site. And if the participants go to 3 out of the 4, they get their full participation. And so if you're full participant in the fall, full participant in the spring, you get 4 wellness points towards your total 8 that you need for a premium discount. And so right now we're seeing about 25% participation rather than 6. So if we can spread that next year to all of our schools and departments, and much broader participation in the wellness program than what we currently have. It gets people active and moving and just you know, more, a little bit more health conscious.
I don't know how to know anything about this, but someone actually told me something about, like, I got money from that. I really think y'all would have more employee, and I know y'all send me emails. Again, as a teacher, we're always like, thanks for the email. And then you're like, oh, check your email. When do you think I checked that email? I got 15 kids right by side of me if I did check it. I know y'all sent out this information, but I've been an employee here for several years now. I had no idea. Someone said, maybe like $100 or a minute. I'm like, no. I think a lot of us don't know about it.
So maybe we can add that to the January 6th.
Like really know about it. Not like, oh, there's a, like I knew there's a wellness program, but I didn't know all the things I could get.
Right. Right.
And that would give you, if you were able to do it January 6th, then just a little alert, then you have time to get it done before the end of the year, you know, before.
And that's another thing about the wellness program at the school site, is that, to their point, there's a whole lot more of them than there are just us. We have 75 sites, we're gonna have 75 health leads. And so there's more opportunity to get information out. more
Using those
opportunity.
cheerleaders on site, right? Yeah.
So it's more, gets the word out a lot better than what we're trying to do. And it puts some, like Miss Mary Clovis, I don't know if you know her, she's very in your face, she's gonna go ask you, and that's how she's getting participants. She's going to your room and saying, hey, I think you really ought to do this. You know, join up. And so it's and all of our health leads at each school are already doing that. They're just doing it with students. So now we're gonna expand that to our employees.
I think some of it is a messaging deal. In this day and age, everybody, it's all electronic, probably getting thousands of emails and kind of get skipped. I think if you were to take that and we as a board can come in and help Mr. Bourne here real quick and subsidize or give our wellness leaders at the schools a little reward for increasing those percentages up to a certain point, I think that would motivate a lot of them to do that, and then change the message a little bit and put a reward for that person for the work that they're doing. And I think that would help. Let's kind of move on to the next step. I think we're.
Okay, closing remarks, claims are increasing, but at a moderate level as compared to last year at this time when it was 3.2 million. So that's good news. The change in the pharmacy benefit manager is bringing additional rebates and savings per member per month. And I just wanted to remind everybody, last year's increase was 4.8%. The board did absorb that, right? So it changed some of the allocations from the historical allocations. So just wanted to make that comment.
I'm gonna ask, well, I don't know the answer. The board absorbed that increase last year. Okay, so if we have an increase this year,
No,
is that gonna be put into, or is we're still going through that? So will we hit like double? Will we hit with the?
Right now,
Increase from last year and an increase from this year?
right now, if things are trending as they are, so back to slide slide one. Right now, mid-year, we're at $890,000 over budget. So if you just double that, it would be roughly 1.7 million. The rebates would equal about 1.5. Okay, so we would be over budget by about $200,000. So things stay.
Which for a plan your size,
Is excellent. We're talking about $55 million, and we're projecting $55 million or $200,000 in the budget, so we're really close. So right now, for this year, we wouldn't see any,
everybody
we
know.
would not see any increase.
Right,
This
but
pay.
if we get, then it would be.
That would be up to the board, but I can't imagine the board would
That's,
go
those
again.
are the questions I've been asked.
it's the performance of the
It's
plan.
fixing
that drives
that.
the numbers. It's not gonna be a double jeopardy, it's gonna go back and forth.
Right, they're not gonna go, they have to deal with the current year to the next year.
Did the tax renewal this weekend have any impact on our situation?
No. No, just because this is a self-funded.
All right, we've gotten to the last slide. This was a very robust meeting. I loved it. Great feedback. I mean, really some good takeaways. So excellent presentation. I just wanted to thank you all for your time and for your engagement today. The next meeting is on the back of your day, big and bold, the 25th at 5 o'clock. We will need a quorum. So thank you in advance for marking your calendars for February 25th. It is right before Mardi Gras, so who knows? I think Malika said she's bringing king cake. I don't know.
Motion adjourned. Motion have a motion and second, all in favor, say aye. Aye.